Okay guys, let's start. Like, no worries, don't worry, sorry, it's my mistake. So this one was the thing. If you if you see that, like, this is the question. This one was our question, that someone with this scalp problem, you just attended the whole question, and I asked what's the diagnosis. The diagnosis was Parkinson's or the HIV actually. Okay, so HIV is not here, Parkinson is here in the stem. So, and here is the answer. Someone's microphone is on, please, like, mute it. And as I asked, like, what are the conditions that is associated with patchy hair loss? There are 4 conditions: the tinea, seborrheic, alopecia areata, and trichotillomania. I was asking, how do you know, like, something is about like trichotillomania? What they do, they pull their own hairs actually. So, but still, if the patient is coming, the patient will not tell you that the person is doing like that. How would you like get to know? There will be active hair follicle. So just remember or write this thing: active hair roots. Someone's microphone is disturbing, please take care of that one. I'm getting a lot of sounds, guys. Please mute your microphone. Yeah, now looks okay, thank you. So there would be active because you just pull it, so the follicle is not gone. So the condition we call baldness, even. Yeah, sorry, baldness. Okay, so that condition, you can differentiate with seborrheic dermatitis in this way. In baldness, there would be no active hair follicle. No active hair follicle. So that's how we can differentiate actually. Great. So this was the question number 1. Answer is B. I hope you all made it correct. So next one we are coming. This one was the question. A picture was been given. If you see this picture, maybe I have shown you this picture in previous class, or also the histories are given. Some swollen, some pain, some fever, swollen, red, pain, fever, someone on antibiotic even given. And can anyone tell me first of all what is this condition actually? Cellulitis. Okay, excellent answer. And is it possible cellulitis we can treat as outpatient, like means outdoor in the hospitals? Yes, it is possible. Actually, that thing happened here. Someone who was treated in outdoor, but still after 1 week it was not solved. So now the question is, should we take chance, like again giving oral antibiotic, or should we admit to hospital and go for some IV? What do you think?
Admit to hospital.
Admit.
Yeah, so see, hospital admission for IV antibiotic because of lack of response to oral antibiotic in some particular hours. Cellulitis could be very deadly. It could be life-threatening. So we don't want to take any chance. So here the appropriate answer is A. You want to see the question again? Yes, this is the question. So the appropriate answer is A. This one. Okay. Remember, DVT and cellulitis. Just take a note here that both we can treat as outpatient. This is important for us. So this type of scenario, they would give you, they are treated initially, again they came back, it was not solved. That means a treatment failure case. If it's a treatment failure case, you need to go with the IV. That's important. Okay, let's just me ask, like, what is the treatment of DVT, deep vein thrombosis? Like, out of context, let me just ask. What is the treatment of acute DVT?
Clisane or Inohep.
Claxon means you mean to say heparin, right?
Yeah, heparin, low molecular weight heparin.
Low molecular weight heparin. That's correct answer actually. Yes, that's the answer. Okay, good. So this is the question 2. Let us go to question number 3 now. Okay, here the points are given, like why this is answer, why the another is not answer. Basically our concept is clear. It was treated as outpatient, it was not solved, so we need to treat it as, like, we need to give IV, and we don't want to take chance again sending the patient to home, we need to admit the patient, because cellulitis could be very dangerous actually. Okay, so question 3 here. Okay, this is if someone read MC bestseller, I feel they know the answer. So this is a case, 52 years old, came to your office after watching a television program about melanoma. No family history, no past history about a skin disease, only olive man syndrome. Okay, now there's a word, olive man syndrome. What does it mean actually? Olive man syndrome, what does it mean actually? Like, you're suspecting with melanoma, name some risk factors of melanoma. I'll try to get the answer from you. So family history, agreed. Family history. Can I say mole is a risk?
Multiple
Yeah,
nevi.
dysplastic nevi or mole is a risk. Another?
Fair complexion.
Fair complexion, excellent answer. Fair complexion. And
Sunlight.
yeah, good. Sunlight. Can I say sunburn also?
Yeah.
Like,
Yes.
someone who is a sunburn. So out of them, which one do you can compare with this term? Olive man. There's no such olive man syndrome actually, but this olive man, maybe sometimes it's a patient's word, or in the exam they like to use this type of term. This is actually they meant to say sunburn actually. Okay, so if someone having sunburn, what do you think? Which one could be the answer?
Screening every 2 years.
Okay, screening every 2 years. Screening every 2 years. So
Every 6 months.
what do you think about the answer? Screening
Every 5.
every 2 years actually is the answer. This answer also I think little bit details given in MC bestseller, if you can see. Have you read that one? Like this, is this question was there? Anyone can tell me the page number? Can check and tell. Yeah, what's the page number? Okay, I'll give you time for the other members to help that explanation. So it's a combination, guys. Like, everything is required. That's why. Yeah. So olive man syndrome, we take it as a risk factor, and there is a line of risk you need to assess. We need to, assess them, every 2 yearly. 2 yearly. In case of sunburn or the olive man, that one. Okay. Maybe after class, I might provide you. Yes, doctor. Page number. 47 page. Okay, excellent. 47 page of MC bestseller. That answer is given. So guys, you can also check that one, or maybe doctor, you can also share the page for the other members in the Skype if it's okay. Okay, excellent. So thank you. So it's page number 47. More details are given. This one you can also count. I think melanoma we discussed also a little bit. So if like just a quick inquiry about melanoma, that melanoma, how much millimeter of margin every time we should cut?
2 millimeter.
Yeah, 2
2
millimeter.
million.
Okay, if you diagnosed with melanoma, what test you want to do, like as like a follow-up? Because melanoma, like most common site of metastasis is lung.
Chest X-ray.
Lung.
Lungs.
So we go for chest X-ray, CX-ray. Okay, great. So okay, which one of the melanoma is most common among the all types?
Superficial spreading.
Yeah,
70%.
Yeah, superficial spreading. Yes, excellent. 70 to 80%. Superficial spreading. And which one has worse prognosis among the type of melanoma?
Melanotic.
Melanocytic melanoma. Okay. So a lot of nice information. Okay, what is the time of using sunscreen in Australia?
10 to 3.
10 to 3. 10 to 3. Excellent answer. 10 to 3. And there was another question I remember. Okay, melanoma in the eye of a child. Eye in a child. Yeah, so our answer was excision. So these are the some questions you should remember. Common site of metastasis of melanoma: lung, followed by liver, followed by brain. And there is a handbook question. I'm not sure have you find that question later or not. There was a CT scan given and the brain is showing some lesion here. So it's they ask about the primary source. So what is the primary source? The primary source was melanoma. But if you ask the melanoma, where is the primary site? The primary site is lung. But if in the brain a question is given and they ask few other things, this thing you will find that primary source is melanoma. Okay, so these are the some informations we have from the melanoma right now. Also, don't forget to read about basal cell carcinoma, squamous cell carcinoma, Parley age, that is belongs to which one? Parley age, in the nose if there is a basal cell, and upper lip.
Basal cell.
Basal cell.
Yeah, BCC upper lip and SCC lower lip. This
Oh,
one,
no.
yes, this is very good. This thing is very important for MC. Upper lip, this is the basal cell, lower lip, squamous cell carcinoma. Excellent. Next one. This is could be little tough. See this lesion, maybe little different. 22 years, referred to dermatology clinic. Notice some small areas of deep pigmented arms and legs. Well, the areas are well circumscribed. So what do you think? She's mentioning about oral contraceptive, sexually active. This is, I will count as a little tough question. Yeah, this one if you miss, I don't mind actually.
Vitiligo.
You want to go with vitiligo? Okay, I agreed. Okay, vitiligo, but agreed on that note. Vitiligo is the diagnosis, but they ask this type of question: which one of the following you have association? So more.
Pernicious anemia.
Anemia?
Pernicious anemia.
You want to go with pernicious anemia? Okay, let's see. Yes, your answer is pernicious anemia. See, vitiligo is an autoimmune disease. You know the famous pop star Michael Jackson? I'm sure everyone knows. I was a big fan. So, he was, before he was black and then he turned into white. Do you think, and it was claimed that plastic surgery was done, but do you think it's true? Is it true that actually plastic surgery done whole body? No, it's quite impossible. When he died, autopsy was done, and it was diagnosed as vitiligo. Some people know from the beginning. Yeah, so it's important. Someone's microphone is on. Just a second. Someone's microphone is on. Okay, so so it has more association with couple of disease: pernicious, autoimmune thyroid, type 1 diabetes. Yeah, so please note down these names: pernicious, autoimmune thyroid, type 1 diabetes. Here given type 2 diabetes, not type 1. Primary adrenal insufficiency, this one and this one. So our answer, if we go back again, the answer would be, so type 2 is not, no, hypopara is hypothyroidism, not this one, not this one. So our answer is pernicious anemia. This is correct. Great. Okay. So vitiligo, it's an autoimmune disease and has some association with other. Actually, autoimmune, all diseases has some association with other autoimmune diseases. This is a fact. Okay. Sorry, question number, I think 5. I think I repeated. Sorry. What's the answer of the 5? Can you check the question? Question number 5. Sorry, this was not the question. Question was like another one. So what was your answer? Squamous cell carcinoma, isn't it? The answer was squamous cell carcinoma is given. Yes. In question number 5. About, if I say something about squamous cell carcinoma, You know, is this more aggressive compared to basal cell carcinoma? What do you think? I think the answer is yes.
Yes.
It is more aggressive. It is
In
more
lymph
aggressive.
nodes.
Yes, it is more aggressive cancer. Basal cell carcinoma, just remember a line, it is almost never metastasized. There was a line. You know, sun exposure, yeah, sun exposure almost, you know, related to all the things. And if you compare the looks, this squamous cell carcinoma has, you know, little bit more ugly looking. I personally feel basal cell carcinoma is a little bit more pearl type, pearly, you know, appearance. So also I think we discussed about the lips. In case of lips, the upper lip is BCC, the lower lip is SCC. You know, if I ask about the someone's nose, this is goes with BCC or
Basal cell.
BCC.
Basal cell.
BCC. Usually, like, you know, because of the like more sun, more exposure, you know, lateral canthus of the eye. If you draw a picture of eye, and you know, in the lateral canthus, this is also BCC. Okay, so that you just need to remember this thing, some of the sites. So all the sites of the cancers are very important for MC.
Sir,
Yes,
I
doctor.
wanna ask
Yes,
one question
sure,
that
doctor.
because it's repeatedly asked that what is the prognostic factor of BCC?
Okay,
Is
prognostic.
it site? Is it width? Is it thickness? Or is it cancer cells at the margins?
I think for BCC, I think there was a word, you know, it could be cancer cell in the margin.
Margins.
Yeah,
Okay.
cancer cell in the margin. Little bit different here. It's a very good question. And for melanoma, I think last day we decided something.
Thickness.
Yeah, thickness. This is a very nice question, doctor. Thanks for letting in. Yeah, I think this is the correct answer. It's in the margin.
Okay.
Yeah, yes. Thank you. Nice question here. Okay, next one question. 17 years old male presents to your office some spot in the face and got much worse recently. This is the word, much worse. So it's progressing. Several history of acne. So it's not a good case of acne. It's a bad case of acne. And we can also see several pustule and papule. So what do you think what could be? So it can be kind of like a, you know, name some types of acne. Remember from the last day? Lot of types of acne, isn't it? One of the types was pustular. Remember? Pustular, and another one I told about is the nodular.
Nodulocystic.
Nodule. So which one is them? Which one of them do you think is this one, or this is just simple one?
Nodule is where?
Okay, we like to go with this one. So if you remember this thing, I hope so you also remember nodulocystic. We decided a treatment in case of nodulocystic.
Retinoids. Oral retinoids.
Oral retinoids. So okay, so your answer is oral retinoids. Oral retinoid, we need a, you know, precaution. What's that? What's the precaution?
Not in pregnancy.
Yeah, so, and yeah, you can't afford to get pregnant, and if necessary you should use, you know, double barrier, you know, double contraceptive. Yeah, like pill plus at the same time. So because it's highly teratogenic drug, retinoic acid. Some people ask me cream or the oral, both are teratogenic. Okay. What is the time of using, you know, retinoid? Anyone knows? Is it daytime or nighttime?
Nighttime.
Why
It is
nighttime?
photosensitive.
It is photosensitive.
It is photosensitive.
Excellent answer. It is photosensitive. Yes, very good, guys. Very good, guys. So this is the nodulocystic acne. You all are correct on that note. Very happy with the performance. This is nodulocystic. Yeah, acne has lot of pathophysiology. We told last day there could be the blockage, there could be organism like Propionibacterium, there could be increased secretion, sebum. So anything it could be, but this is nodulocystic. You can go to Google and see some more pictures about. It's like, you know, it's so much acne in the face, and it's like nodules. So, you know, if you give antibiotic, it will not help here. If you give the simple creams, they already tried actually. So you need to go with the oral retinoid. It's a very good, you know, it has very good cure rate. This is a handbook question, I think. So what do you think?
Thickness.
Thickness of the tissue.
Yeah, so all agreed on that one. I think in handbook, you should check it from 3 point. Remember how many pages? 3.001. There was only 9 questions, isn't it? So 3.009, at least 9 questions, but still those are available. Those are helpful. So here our answer is D. Okay, so yeah, 3 point. I want you to open that one again later, not now. So the answer is actually D, thickness, and the diagnosis is, yeah, it's given already. It's melanoma. Great. Okay, we have another one, and this is also from handbook actually. So something happened with the nail. So
Ingrowth of nail. Drawing of the nail.
can we call it paronychia?
Paronychia, yes.
Isn't it? We can call it
Yes.
paronychia. So if it's a paronychia and side of the nail is involved, so I just give a hint already in the picture. What I should do? Remove the hole.
Wedge resection.
Yeah, it's a wedge shape resection of the affected region, or any other thing. I think it's a wedge resection or wide excision. What do you think of the
It's
affected?
wedge rejection. Should be wedge rejection.
Yeah, should be wedge resection. So paronychia of the intoing nail, actually is paronychia of the intoing nail. So wide excision of the affected part. That's the correct answer here. Very good. There is a interesting question. College student young, itchy rash. Okay, itchy. Remember the word pruritus? We 4, 5, 6 diseases we initially learned about pruritus. So that pruritus came. Intense more at night. More information. Yeah, and I think more friends are affected at the same time. And there was a it's a web space, isn't it? What is this called? Yeah, web space in the finger is given. Classic picture. Okay, so this is diagnosis confirmed as scabies. Okay, so what is the following is the most appropriate pharmacological treatment in this case?
Permethrin.
Okay, so your answer is here. We like to go with permethrin cream. Permethrin. Okay, some people might ask me, this ivermectin. Even last class, someone asked me, when is ivermectin is the answer?
Crusted. Norwegian scabies.
Yeah, two condition. One is the crusted, and another is Norwegian. Okay, so this means it's a treatment failure case, advanced case. In that case, we can go with the ivermectin. It's an advanced case of it's Norwegian or advanced. So search in Google with Norwegian, you will see a devastating condition. Okay, and just remember one new information, guys. There is another drug. Everything failed. You are looking for a new drug. It could be linden. This one maybe I didn't told in last class. So linden. So always we started with 5% permethrin. Previously used benzyl benzoate. Nowadays permethrin is more important. This 5%. Anyone can tell me 1% permethrin is used in which case? Anyone? He or she will answer. Will get a Cadbury's. Anyone? Golden chance. Good.
Nappy rash.
Lice. Who said it? Lice. Okay, doctor. So one Cadbury is for you. If we visit ever, so I'll give you that one. Okay. No worries. Okay. So yes, it's 1% permethrin is used for lice actually. Great. First of all, child ate prawn pie in the restaurant and developed urticaria. It's told actually in the question. Sometimes they don't told also that this is urticaria. They give you the feature. They might give you a picture here. Okay, so you have to diagnose in that case. Here they already told. Sometimes it has been told, sometimes picture is given and features are given. You need to pick up. You remember with urticaria I told about is this the mild to moderate or is it severe? How do we know this is severe?
Spider.
There will be wheeze or chest symptom. Chest symptom, wheeze or chest symptom. So this thing is supposed to be present here. So in this case, is it happen? Yes, I think wheeze is there. Yeah, they said no other respiratory symptoms. Some people misinterpret this on that. Okay, it is said without any other chest. Other symptoms are not like there. That means, but wheeze is there. So it's a, that's the thing we need it actually. So it's a severe. So if it's a severe, what's the treatment?
Adrenaline IM.
Yeah,
IM adrenaline.
yeah. So your answer is adrenaline IM for severe urticaria. I think we also read from John Murtagh last class that the IM adrenaline. So keyword here is the wheeze or the chest finding. Okay, guys. Thank you. Now we'll go about the